COVID-19 is the first pandemic the world has experienced in more than 100 years, and also the first epidemic we are experiencing at a time of social media. As the world continues to grapple with the disease, we're also seeing the rise of a new phenomena known as infodemics. Welcome to Data Ethics Conversations. Today we talk to Dr. Iris Isip-Tan, endocrinologist and staunch advocate against disinformation. We will talk to Dr. Iris about how to manage infodemics, understanding the role of social media in the spread of health disinformation, and also the role of government and experts in risk communications. If you enjoy this podcast, please like it on Facebook, subscribe on YouTube, follow us on Twitter at EthicsPH, and also on LinkedIn at DataEthicsPH. And now my conversation with Dr. Iris Isip-Tan.
Hello, and thank you for inviting me. So I'm going to talk about what I learned at the World Health Organization Infodemic Manager Training. I applied for it last November 2020, and there are 3 other Filipinos who were with me in this global cohort. It was a month-long course, and we had like 8 live sessions lasting 3 to 4 hours each.
Wow.
And this opportunity for me to talk about sort of like looking back at what I did last November. So it was really fun putting together this slide deck.
Right. Maybe before you start, can you, I'm sure there's lots of people who know you already as the endocrine witch, no? But for the few people who don't, maybe just a short,
Okay. So I started to go online. I think it was 2010. I had started blogging earlier than that, but in 2010 was when I put together really a blog that said Endocrine Witch, and that I had put up a Facebook page like 2012 and called myself Doc Brew. So the impetus for that was really there was a lot of misinformation online about diabetes and thyroid disorders, and I'm an endocrinologist. There are only about 300 plus endocrinologists for the entire Philippines.
Wow.
And I was thinking that there would be space for explaining endocrine disorders completely in Filipino to help our countrymen. And that's how I started. And the Facebook page is still going up to now, though I only post on it when I can because I'm also quite busy.
So that's interesting. Even as early as kailan ba yun, 2010, you were already talking about misinformation, medical misinformation at that time, no? So yeah, this is something that it's practically your practice, basically, no? Talking about fake news and stuff, no? So anyway, don't let me keep you. Please proceed, no?
And I think that's probably why I got attracted to try and apply for this infodemic manager training. And so maybe let's start with the definition of an infodemic. So it's an overabundance of information, some accurate and some not, that occurs during an epidemic, and it just spreads. And what struck me with this definition, because coming in, as I said, my background was on misinformation in health. So it struck me that in an infodemic, it's not just the misinformation, but it's all the information, that overwhelming amount of information that you can't really tell which one is accurate or not anymore. You're just overwhelmed by it. And then you can't find the information that you need that could protect you, your family, or your community. And so when I was trying to put together this slide deck, I was thinking, how do I organize it? Because, it's like a month's worth of training. And I decided to use the framework for the infodemic response, which they taught us, and it has 5 items. And my thinking was I went through my notes, I went back on my tweets, and tried to incorporate the things that struck me for each of the items here in the framework. So for example, let's just enumerate them first. Interventions and messages must be based on science and evidence, and that you must reach the citizens and enable them to make informed decisions. And that knowledge should be translated into actionable behavior change messages presented in ways that are understood by and accessible to all. And that governments should reach out to key communities, ensure concerns and information needs are understood, tailoring advice and messages to address audiences. To strengthen the analysis and amplification of information impact, strategic partnerships should be formed across all sectors, including but not limited to social media and technology sectors, academia, and civil society. And lastly, that health authorities should ensure that these actions are informed by reliable information. They should be able to understand the circulating narratives and changes in the flow of information, questions, and misinformation. So those are the 5, and let's go through them one by one. So the first is interventions and messages must be based on science and evidence. And at first I thought that should be easy, right? Because as a medical doctor, I learned about evidence-based medicine. But really, they said uncertainty is always part of public health emergencies. And so in the beginning, SARS-CoV-2 was even called the novel coronavirus because not much was known about it. And so the disease is fast while the science is relatively slow. So what you have is an information asymmetry that needs addressing. And then the public wants to know more. But if we follow what is said there, that we need to adhere to messages and interventions that are science and evidence-based. But what if you don't know? Okay, so then it's not really easy. And so I will have some quotes from different people in the training, but because at the World Health training, they said we have the Chatham House rule where I could share what I learned, but not say who said it. So what I have here is like a description of who said it. So one of the risk communication experts that we had at the training said that explaining the science does not influence risk perception. And so even if there was science to be communicated, what happens if it has no effect, right, on risk perception? So a risk perception is an individual's assessment about the possibility of harm to one's livelihood or the local economy. And when I was taking the training, I was remembering what was happening here at home with us. So the public was being told to keep distance and that public transport may be risky, so it will be difficult to enforce physical distancing. But people will take public transport because they have no choice. And I know that on Twitter, people were saying, I have to do this because if I stay at home, hindi yung virus ang ikamamatay namin, kundi gutom, and so I have to work. And so there you see the difficulty. And because the science is imperfect and the evidence is still being studied, it's still forthcoming, one has to say what is known and what is unknown. That's what they said. But to set expectations for change. So you can say there's a study ongoing regarding X, and I will be able to tell you more when that study is finished. But when you don't have the answer, they said to be transparent about how decisions are being made. And so in the training, they showed us a video where someone was talking about a comparison between the Spanish flu of 1918 and the current COVID-19 pandemic and how messages were being communicated even back then in 1918. And the speaker said, tell the truth, don't hold back, but put in context. People can deal with the truth, but people have to trust you to follow your recommendations. They can tell if they are being lied to, explain without condescending, answer the questions. And I have a lot to say, which I cannot say about what I see on Twitter happening with all our experts. And then someone said there also advice for the spokesperson. If your mindset is, we don't want to scare anybody, you will lose the battle. If you don't know, say you don't know, and this is why we don't know, and this is when we will know, give out all the information. And I was thinking it must be so hard to be a spokesperson, and I understand why we cannot all be like Dr. Fauci. So they also emphasize the messenger matters. So even when information is available for health authorities to communicate, it is not always communicated through the right messenger, at the right time, through the right medium, or in the right language. And I know we have very strong feelings about the messages we've been getting and from whom. So it can really get convoluted. And there was a quote from one of the speakers that they said, if infodemic management is treated as issues management, or designed to mitigate and protect reputational risk of health authorities, it can backfire. So really, there's much to be done about how we can deal with the infodemic. And I was thinking about what they said. What should be the characteristics of a good spokesperson? And I think about Dr. Fauci, but I also agree with this quote that scientists are well versed in the role of uncertainty in research and are trained to utilize a form of communication known as hedging. So we'll say things like there's not enough studies. However, okay, but in contrast, journalistic practices aim to distill complex narratives into digestible, emotionally engaging content. So I'm thinking, how does Dr. Fauci do his hedging? Because he's doing it in quite an engaging way and people understand.
I don't know if I can react immediately, on this.
Okay.
And you might be covering it in a later slide. One thing about communication via social media, and I think that's part of the problem, is you're forced to condense it in a 120 character tweet, and so it's hard to get context, if you're going to parang abbreviate, that's one. And I don't know if this is unique. I don't know if you have a comment on this. If this is unique to the Philippines or other countries have the same problem, pero I feel that we're not used to seeking advice from experts, meaning public opinion. We like experts to be definitive. We like experts to tell you, oh, it's already done or it's still ongoing. No? We flattened the curve or we haven't flattened the curve, etc. And then suddenly you have so many experts contradicting each other. I can just imagine, and maybe that might be even a new phenomena kasi nga, we've never had a pandemic before. It's been more than 100 years. So I don't know if that's part of the challenge, in managing infodemics now, the nature of social media, and I don't know if it's also a culture. Now we like our experts to be definitive, but as you said, science is probabilistic. No, it's always there's an uncertainty. Parang it's hard to listen to uncertainty. You want to say, do you really know what you're saying or not? No, parang tell me na lang if this thing's happening. I don't know. Just to
So my
react.
experience has been running my Facebook page as Doc Brew. So I remember I was trying to explain that a certain drug does not harm your kidneys. But to do that, I had to explain some pathophysiology. And I had to do it in Filipino. And I thought that I did a good job of it. And then in the end, when you see the comments, they just want the bottom line. So, Doc, in the end, does X damage kidneys or not? So I felt so frustrated because I had explained everything in what I thought was an elegant manner, but they just want like the bottom line, right? So it's hard. And I have had discussions with other people on social media, and they've told me, for example, you need to simplify, but there are things that I cannot simplify. I had an argument with someone where he posted that diabetes is diagnosed at this level, and he didn't mention pre-diabetes, which is that borderline part. And then he said, but for the sake of clarity, to make it easier for people to remember, and I just didn't want to give up that detail, But really, that has been present. That difficulty in communicating it in simple enough terms without losing, I don't know, the meat of it.
Yeah, I agree. Yeah, and then isingit ko lang, no. Like I am not from the medical field, but even in the data analysis field, you're also told na before you present the details of your analysis, cut to the chase agad. What are we gonna do? No? Action, and then explain it why, because the data says so. And again, I experienced that people don't want to hear the details. They want to just be told, no. So that's one thing. And then, but pagdating naman sa COVID, and I don't know if this is already a thing, like a phenomena, parang the advice you're given seems, as you said, asymmetric. The advice you're given seems so simple, like wash your hands, wear a mask, wear your face shield, keep socially distant. Compared to the apparent magnitude of the pandemic, the action you're being advised seems so simple, seems so minute. So
Yeah.
parang it's so counterintuitive. So people don't believe it. Na talaga, I'm just gonna wash my hands and this whole thing goes away. So, diba, it's really strange. I don't know if that's just me or that's just the Philippines. No?
No, I've heard that before, and that's why people go for all sorts of alternative treatments because they sound so high tech. Like this does this and this does that, which goes beyond, just hand washing and everything. But maybe it will come out here also in the second part where I'm talking about knowledge should be translated into actionable behavior change messages. And the example given here really struck me as an endocrinologist. So the WHO technical officer was saying the knowledge deficit filling model is insufficient to frame an effective communication response. And that we need a more tailored approach targeted towards changing behavior. And so the example given was, you do know that we have a lot of evidence, there's science behind it, that exercise is good for your health. So why don't people exercise as much as they need to? Okay, and I really resonate with that as an endocrinologist because I tell my patients that all the time. You need to exercise to lower your blood sugar, etc. And they know that that's true. So, but how come they don't do that, right? And so they were giving examples of how to make the messages something that's actionable. And the example they gave us was the New Zealand alert level system. And so if you go to the website, it says the alert level tells us what measures we need to take. So even the language, it tells us. So it's all about us. It's all inclusive. We, the New Zealanders, okay? And so it has levels 1 to 4, where they say alert level 1 is disease is contained. Alert level 2, there might be some risk of community transmission. Alert level 3, it's high risk, but the disease is not contained. And then alert level 4 is really lockdown level. And so right now when I check, for example, it says that only Auckland is at level 2. So if I lived in Auckland, I have this list that says what I need to do. And if I lived anywhere else in New Zealand, then it will be alert level 1. And they were also telling us about the inclusiveness in the messaging. So like for aggressive lockdowns, they were told, go hard, go early. But then we're all in this together. Be strong, be kind. And we're a team of 5 million. And that was really in contrast to what I was hearing here, where we were being told, do not be pasaway. Wag maging pasaway. So I really think we need to work on our messaging really.
Yeah, that's very blame oriented, no? Parang yung messaging natin. And especially, well, again, just to murky it up further, there's a trust issue on both sides. Parang the government doesn't seem to trust the citizens, and for the most part, the citizens don't trust the government. And it doesn't help then, I mean, since I've also been involved in kunyari, the measurement of COVID, no, with the metrics, it doesn't help that we all accept that the data is not as accurate as we'd like, or it's not as complete as we'd like. But then that's where the risk communication should come in. No? You smoothen out that but yeah, I can't help but agree. Now we're in a totally opposite to New Zealand, definitely.
Yeah, and here they were saying co-create the message with members of the community. And I hear that a lot because, in the UP College of Medicine, they talk about community-based medicine, but, I'm a specialist. So it's really like I've never seen a barangay health center in the last how many years. The last time I did go was because I was a health informatics student. But here it said gather the data, but translate to action with the community and move beyond messaging and support community-led solutions. And I remember early in the pandemic, I was doing some volunteer work and they were asking me, can you translate these into Filipino because we're going to make some COVID comics and it's all going to be about health measures. And how do you do like physical distancing? What do you do if you have a small house, etc.? And people were saying, okay, how do you divide up a house that's only very small and what do you do? And so really, we need to move beyond that. And what really happened in the end was, you really can't make a guide for how to do social distancing in a small house. So if you talk to the people in the barangay, they were themselves the ones who told us, we're just going to put up a barangay quarantine center. And that's where people need to go. If they have people who are having symptoms or need to be quarantined, they can't stay in their houses and they have to go to the barangay quarantine center. And that was something that wouldn't have come up if, there wasn't a discussion with the people actually in the community. And then formulate infection control measures informed by rather than against culture and context. And a recommendation that conflicts with cultural and practical realities may have poor uptake despite appropriate risk perception. And the example given here by the speaker was about burial practices in the setting of Ebola. But locally, I was already remembering how people were scrambling to comply with the masking measures. I remember we saw on Twitter somebody put a sanitary napkin, used a bra, etc. And then at the same time, we were posting information on how to convert, for example, t-shirts, scarves, handkerchiefs into clothing masks. And then still the ongoing debate, right, about the face shields and how people are debating whether they should follow that or not. And so I really think culture and context needs to go into it. So compliance with public health recommendation is a function of public trust, and you did bring that up earlier already. What struck me was when the speaker said, gaining trust is a process and not an end state. Community engagement may not entirely dispel centuries of historical distrust, and the context given here was in the treatment of African Americans and the Tuskegee syphilis experiment. But locally, we don't even need to look that far in terms of centuries, because only a few years ago we had the dengue vaccine, which has certainly contributed to the vaccine hesitancy we are seeing now for COVID. And so how do we gain that trust back? And so there were some discussions also with a social scientist, because she was saying, if you want to translate the knowledge into messages that will lead to behavior change, you also need to look into cognitive biases, and there are backfire effects. So here she discusses familiarity backfire effect, when the misinformation is remembered more and is remembered as being true. So you may show somebody the debunking message together with that, but they'll remember the misinformation rather than the debunking information. And for me to recall the example, for example, of vitamin C, people associate it with taking colds, and the data actually says, it's really not helpful for every day, but some small studies show that if you take it before the symptoms start, it might, shorten the symptoms or the duration of the symptoms, etc. But people don't remember that. They just remember the vitamin C part and then the colds. And then there's the overkill backfire effect. Information that is easy to process is more likely to be accepted as true. And so they were telling us, always watch out for data deficits. Because you know what? If there's a data deficit, someone is going to fill that up with something, and that something might be misinformation. So you have to be constantly monitoring the data deficits and fill the gap with alternative explanations that are plausible but true. Okay, and correct.
Is this the phenomena that leads to mga conspiracy theories? Kasi that's the
Yes.
people supplying the gap, diba? Parang
Yes.
the truth is just too simple. Parang it can't be that simple. Parang it has to be a more complicated conspiracy behind the scenes, no? It's really interesting if that's
And that's
human
even
nature.
so hard to debunk, because they'll say, no one will ever tell you that. It's a secret.
Yeah.
Right?
Yep.
You won't find it anywhere. It's in the FBI files or something. So the other one is the worldview backfire effect, which they say it's the hardest because it's really confirmation bias, the tendency to favor information that confirms already your existing beliefs. And the advice is really do not threaten worldviews. Okay. And the example given here was climate change. I don't know if you've noticed, but they've reframed climate change, at least for the US, as a national security concern. It's being communicated as such by armed forces rather than like the scientists. And people are saying there's turnaround in some of the people who deny climate change because of this. And then there was also discussion on focus your energies instead on the undecided, those who are still open to getting convinced, rather than threatening worldviews and you don't get anywhere because there's confirmation bias. And I guess having seen the phenomenon of like DDS versus Dilawan, there's really merit to that. And in fact, somebody said at one point you really have to stop debunking and just communicate openly with kindness on what needs to be done. And again, they were showing us the New Zealand messaging for COVID-19. So somebody said, stop telling people they are misinformed because, that's not going to get you there. And at the same time, you need to stop assuming that misinformation or information equates into action, really. And so we need to work on that with our messaging.
Yeah, the immediate reaction is always mali ka, no? This is what it is, no? And people just shut down, no, when you tell them they're wrong upfront. That's really
Yeah,
lalo na on Twitter. That it's much more fun to troll people than to explain to them, no, the way they're wrong, no. It seems to be the way the place is wired up, no.
Yeah. Yeah, and then like they look at people who squirm and can't get out of it, right? And that's how it works. Okay, the third really is government should reach out to key communities. And during the training, they actually showed us the DOH be the solution as an example. The marketing guy who was giving us the talk was saying, well, look at this one. They had a reference to superheroes. But there's also someone from a nonprofit who said to us, if you're going to do an information campaign, never use actors and find someone from the community. For him, it's because that someone from the community is both the messenger and the message. And he told us, let them say what they want to say. Get out of their way, so let them tell their story. You can always edit it out later. And what the thing you can do is to just check if it's factual. And he was showing us some powerful examples about people talking about, they had a campaign for opiate overdosing in the US, for example. So, and then he was asked about celebrities. So, because we have that, the influencer, like if we're going to have someone get vaccinated, let's have an influencer get vaccinated. And his view was people listen to celebrities, but they're not peers. And so he was saying their effect on behavior change is dubious. Unless the effect is there's a realization that, yeah, that celebrity is not like me, but I have an aspiration to be someone like that celebrity. And so I know it's been discussed on Twitter. What do you think about Alden and the Be the Solution campaign, for example? And then we discussed the social media iceberg because this part is really about reaching out. In this training, we were challenged to come up with strategies for those who are not on social media and even for those who are not online, period. Okay. And even online, there was a discussion about semi-closed spaces. So they're saying as content is shared, it is adapted and amplified for and by different groups. And when one platform applies restrictions, the content simply transfers to semi-closed spaces such as WhatsApp groups. I don't know, but for me, actually, I see more misinformation coming out of Viber, and then later when it's gone, viral on Viber, it goes and transfers to Facebook. I don't know, but for me, that's what I see. And there was some discussion you might be interested about the ethics of studying such semi-closed spaces, like because you're invited to a WhatsApp group, or if you're on a Facebook group that's closed, right? Can you actually study the people in there? And one speaker was saying that, well, what happens is that if you are in this enclosed space, semi-enclosed space, you can watch what they're talking about, but you can't actually report it. But once they start to bubble up to the surface on open social media, like from Viber, it transfers to Facebook, then now they're at the tip of the iceberg, and now you can start studying or at least reporting the phenomenon.
Actually,
So,
that's what's haunting WhatsApp now, no? Kasi I think they have a mandate to curtail disinformation from Facebook kasi diba they belong to Facebook. Pero that will in a way undermine the fact that it's supposed to be secure and encrypted. But if you can snoop into messages, that defeats the purpose of the encryption. So it's an interesting dilemma right now, no? How do you manage that, no? And in fact, these, as you said, no, Viber, WhatsApp, mga chats, kasi it's hard to, you can't do social listening on those, eh.
yeah.
They're completely walled off, no? They're like the dark social, sabi nga nila.
Yeah.
That's where a lot of misinformation really circulates, lalo na coming from your parents or your family or your friends. And then you auto share it kasi it came from my mom. Why will I doubt my mom? I'll share it na agad. It's really crazy. No?
Yeah, that's true. They won't show up on the social media listening reports. Okay. Number 4 is strengthen the analysis and amplification of information impact. It's really about forming strategic partnerships across sectors, including but not limited to social media, technology sectors, academia, and civil society. So it's really about breaking information silos. Like, I'm doing some work on this, but then do other people know that I'm doing work on this? And like, now it's good because we've met, for example. And so at the training, they had an epidemiologist talk to us about infodemiology, and he was likening contact tracing as being able to stop the chain of infection. And in an infodemic, it might only take just one person saying, "How do you know this is true?" And that might help to stem misinformation. But then, how often do we actually say that? Okay, how often do we triangulate and see whether the information is true, or do we just look and see who shared it? As you said, if your mom shared it, just share it. Okay. So in the same manner that we have seismographs to monitor earthquakes, he was saying maybe we can have infovalence platforms to detect info bursts and info quakes. However, as you said, there might be some ethical issues there, right? And though the very term infodemic is styled after epi or pandemic, he says misinformation is fundamentally different from viruses and that it is more complex, needing different kinds of experts. And one such expertise needed would be that of social network analysis, but then it would be from an operational lens. How can we use social network analysis to inform our communication strategies? And there's also the lens of utility, because social networks have been shown to have a significant influence on the adoption of new behavior. And I don't know if you're familiar with this, but I only learned about this during the training, the concept of dueling contagion. So the dueling here is the vaccination contagion versus the contagion of the biological agent. So they're saying well-connected individuals are more likely to get vaccinated, as are people who are exposed to friends who get vaccinated or are exposed to friends who got the flu, and therefore they know the importance of getting the vaccine. And right now I'm seeing a wave of my friends, the doctors in my Facebook network, they're all posting their vaccine selfies. And so I'm wondering, will it be the vaccination contagion that wins out against, the virus?
Against the actual virus, no? Tama.
So, but what I really found interesting, but it was a social media expert who actually said, be wary of claims that technology or technical interventions are the answer. And that in order to transform the internet into a place of trust, it will take human-centered design. And so I found this infographic about the shifting paradigm in social media listening very interesting. So it says instead of sentiment, look at emotion. Instead of information, look at the narrative as it is more nuanced. Instead of volume, look at velocity. Instead of looking for what's wrong or right, share the correct information and trusted sources. And very important at the very bottom, it says, look for those seeking information because their questions are valuable. And really, I think somebody needs to be doing these things. Right now, I'm actually working on a research project that involves classifying COVID-19 related tweets according to typology. And we're also looking at tweets if they contain misinformation. And I'm working in parallel with some data scientists who are doing like the natural language processing part. We're trying to see if me manually encoding the tweets and then giving that to them and seeing whether they can do those machine learning processes, if algorithmically they can detect misinformation. And it's been quite hard, right? Because it's not only linguistic, but also certain things like, how do you tell to my limited non-computer background, how do you tell the machine it's satire or parody, for example? Okay, so it's really very interesting how it's never really going to be just algorithmic. There really has to be some human-centered design in there.
I'll tell you already, it's a problem that has been around for siguro decades na, no, in natural language processing. Parang, and I suspect the way kasi we've been approaching it, and I don't know how you're trying to address it, is we're trying to decipher intent purely from the content, from the text. But we talked about metadata earlier, before we started the podcast. But there could be other data points that you can mix with that. Like for example, the same sentence uttered by two different individuals. Maybe it's the individual that matters. No? If it's this person or this type of person, then there's a high probability na satire yan. No? So, but when you run the NLP algorithm, you conveniently ignore the account or the source, or you don't enrich the data with that. You look at just the words or the sentence. I mean, you get something out of it for sure, no, but I suspect there's more to detecting, let's say, satire or sentiment than just the actual text. No, parang, so it's an ongoing challenge. I mean, even kami, we have
Yeah,
problems like that.
I have a social scientist on my team, and he's telling us things like the discursive strategy. And I was like, okay, and what does that mean exactly? What are we looking at? So there's very many interesting facets on how to actually crunch the data.
Yeah.
And as you said, it's just a tweet with limited characters.
Yeah,
That's
but
difficult.
you can torture it as much as you want, pero it'll only go so far, no? And other like other data. I mean, that's where we're headed then. Parang looking beyond just the content, looking at the source, looking at maybe the the timing of it, diba? There are certain times when satire is more prevalent, depending on, because it's a social phenomenon. You wanna share a joke, so you share it during a period where there's more likely to get engagement, no? So may mga ganyang factors. But again, you need a lot of data to actually prove it, and that's why it's currently a puzzle that people are trying to figure out.
Yeah. And because like our data set is from last year, it was really like, okay, we need the time machine. What was the news at that time? Why are these tweets coming out? Uh, this is what I remember, but my memory is faulty. So let's look back at what was on at that time. Yeah, it's interesting. So number 5 and the last is that health authorities should ensure that these actions are informed by reliable information. And as I said, they need to understand the circulating narratives, the flow of information, questions, and misinformation. And this is actually an operational framework that we learned then, but it also appeared now in the vaccine misinformation field guide, and it is available online. It's a very interesting guide. And it has 4 phases where you need to prepare, then you listen, understand, and engage. And when you prepare, first you build a team and conduct an information ecosystem analysis. So as I said, there are 3 more people from the Philippines. So there's 4 of us. 2 of them are in the WHO and 1 is in DOH, and then there's me. And we were thinking of how do we like get more teams together to work on this, because really that's what's needed. Okay. Next is to build a listening system. And so there will be tools, right, on how to detect misinformation. You have to keep a log of the rumors, etc. And so during the training, they really invited people from both Facebook and Google. So they discussed with us CrowdTangle, Data for Good, Google Trends, Fact Check Explorer, etc. There was also some discussion about Tableau, data visualization, and the many ways that even infographics can be manipulated. So now you have a misinfographic, how charts and maps can lie in so many ways, mislead us. And so the WHO has this, it's EARS. It's early AI supported response with social listening. Have you seen this?
Yeah, we've actually been, well, I can talk about it after your
Oh, good.
presentation. No? We
Because we were
were,
wondering if anyone else has seen it and if it's
yeah,
being used, because we're one of the 20 countries
it's
actually
only,
that's here.
we only came about it because we answered a call for papers by PAHO, which is part of WHO, on infodemics. And then yun nga, there's this, it's good that they're building it already. Honestly, maybe part of the challenge is it requires skill sets that are parang well outside the health domain, but they're
Mm.
trying to kind of consolidate it within their organization. So yeah, sorry. Tell me more about this chart you're showing. No?
Oh no, I just took a screenshot. And so unsurprisingly today it's all about COVID vaccines. But really when they were telling us about this, and there's still other websites. In fact, some of us in the Epidemic Manager training, we get emails every now and then, and they ask us to like go on some website and then try it out and see what other information needs to be included. So WHO really has a lot of other dashboards that they haven't, gone public yet. And it's really all about dealing with this infodemic. Um, so I'm really not going to discuss anything more about this graph. So, and then after listen, then there's understand, then engage. There are some examples of inoculation content in this field guide, but what was really eye-opening for me was they made us play the bad news game. Have you played that, right? So the more you spread misinformation, the more followers and points you gain. And I was really telling my health informatics students, maybe we could come up with something similar, but in Filipino. And the concept there is really about pre-bunking instead of debunking. So pre-bunking. So in the same way that, we have a vaccine, which could be, like, for example, a weakened version that can trigger our antibodies, to fight off the future infection. Here, what they're trying to do is preemptively expose people to weakened examples of common misinformation techniques, hoping that they will generate some sort of mental antibodies. And so, like, for example, when
I
I
think there's
played the
early,
game,
there was early research on that already. Exposing people to examples of fake news can help them identify it, further down. In a way, you're kind of inoculating it. I think now is the perfect time to test that theory. Show them examples of really outrageous claims. I mean, you won't hit everyone, so there's an efficacy to it also, just like any vaccine.
yeah.
But I think since it's very early days, maybe we don't even know the full extent of how we can inoculate people yet. There are ways to, in a way, show them. Kasi minsan when you show them all parang a data dump lang of fake news, it might just confuse them, no? So there's also ways to administer a vaccine, an infodemic vaccine, as opposed to typical education campaigns, no?
So we had a discussion about that in the batch that I had. But I've been on social media for quite a while, so I knew all about like trolls and bots, etc. Some of the people who were with me who were in the medical field, they were not aware of those things. And so, for example, in the bad news game, you will be asked, what do you want to do? Do you want to post on a fake news site, or do you want to unleash an army of trolls, etc.? So that's still something new for some of the people. And then after that, there's engage, and it's really the engaged part that's difficult. So, like, how does one respond to a rumor? So these are the questions that are very difficult to answer. Like, would a response actually just give oxygen to misinformation, causing it to spread further? Are there facts or events that you should wait for the outcome on before deciding? What happens if nothing is done? Like, there's a rumor and you decide, well, I'm not going to respond to that. So in order to sort of like tell which ones will you respond to, that's where the metrics comes in. That's what they told us. You have to look at the reach and the scope, and what is the likelihood of spread or escalation, because you might actually debunk something that nobody knew about, but because you debunk it, now everyone knows about it. So, and then one of the things that they looked at was, could it erode general trust in vaccination? Meaning, is it something that's really important so that we need to respond? And what is our capacity to respond? So at the very first meeting, what they did for us in the training is they put us in a simulation. And then it was like, okay, this is a picture that came out, somebody tweeted it, and it was like people in a hazmat coming down from a plane. And then there's rumors that there's now COVID-19 in such and such place. Okay, and then the picture is actually fake. It's from something in the Ebola response. And so they were asking us, would you address this as the Department of Health Minister, or you won't? Okay, and then depending on what you chose, they'll come up with more situations. You did not address it, and therefore a journalist picked it up, and this is what happened next. And then this rumor cropped up in the Viber group, and this is what happened, etc. And I thought it was very good in that they put us in something like that. They also had us in WhatsApp groups, and they had real information drops for a fictional island called El Nor. So there would
to
be
simulate
how it is to be an
situation.
infodemic manager, because it's like, little fires that start like this football player on El Nor got COVID, and then what happened next? And then you'll get a data drop that says the Minister of Health is asking because they want to run a survey. What questions will you ask? Things like that. And the group was working on it nonstop, like from both sides of the world. It was a very interesting but toxic activity. But that really brought to me how everything has to move at a fast pace. Like right now, I'm doing something on Twitter for my COVID misinformation study, but that's really like armchair. I'm relaxed looking at the data. It's not the same when it's, in the field.
It's not tactical, no? I'm
Yeah.
just curious, in your class, were there journalists who were part of it?
Yes,
Or were
there were some who they were not journalists, but they were in charge of like the communication bureaus for like their health ministry. So that's why they were there.
right? I'm only wondering because I've also sat in mga journalists fora, no? And I remember this was way early in the pandemic. Their struggle is they don't know how to validate even expert opinion because they don't have the experts, no? And it's a struggle because it interesting, no, how fact checking is done in journalism.
Mm-hmm. Mm-hmm.
In For the most part, uh, it's just about validating the source. Oh, see, Doc Iris said so, and she's highly reputable, professional. Okay na yun, big check. Without even checking, what did she say? And then you find out now, oops, just because someone has a good reputation, lalo na in this kind of a situation where it's a new phenomena or a new variant of a virus or a pandemic for that matter. It's so many doctors got it wrong actually, or they were unintentionally spreading wrong information. It happens all the time, no? But journalists feel helpless naman, no? Like, how do we know? And then parang Inquirer quotes someone, and then the Rappler will quote another person, and they say completely opposite things. And for the public, it's very hard, no, to manage that. And I heard because my brother works with WHO and he's into risk communication. Sabi niya, I remember he said na that's typically where government should actually step in. The Department of Health will give the definitive view, but we've also seen how that has not necessarily worked out. No, even the Department of Health declarations, especially in the early stage of the pandemic, were actually factually incorrect. No, to put it bluntly. So it's really tough, no, if you're going to manage all that as an infodemic manager.
Yeah, interestingly enough, sometime in February last year, before the pandemic started, I was at a meeting with Vera Files, and we were discussing the same thing about how we can do fact checking for misinformation. And it's really that sometimes it's gray. It's not necessarily untrue, but it's not true either because the studies say, etc. Again, that the thing we were discussing at the beginning. This is actually my last slide. And they call this unicorns because you need to know so many different things. But in the end, it's really not just one person. So it's really going to be a melding of different experts to come up with infodemic management. And the difficulty really is they were telling us that usually if you're in the WHO, you get sent as an infodemic manager, and there's likely only going to be you and one other person, and you have to do all these things. And so they were saying things like try to prioritize things that will have results right away. And then don't tell me about the social media listening report last year said, because that's no longer true now. And so we need what's happening now and what are you going to do exactly about it. So I guess that's where I'm going to end.
Yeah, I mean, just keep it on this last slide, no. One of the part of the ongoing challenge is the fact that, I mean, as you mentioned earlier, it would have been nice if we were, comfortably sitting, behind our desks analyzing this very clinically. The problem we have is as we try to make sense of infodemics, it's actually raging right
Yeah.
now, no? So we have to, in a way, think of immediate steps while we're continuing to figure out basically the nature of the beast, no, and how it came about. Well, just curious, no, and you might have covered this a couple of slides earlier. There must have been infodemics predating social media. Did they discuss that? Kasi during the Spanish flu, wala namang Facebook noon time na yun, no? But presumably, there are parallels. Kasi I remember the historical account. There were a couple of books diba, about it. It eerily resembles today, no? Even the way the measures. Parang if I remember correctly, people parang dismissed it as trangkaso. Parang ganun, no? May ganung aspect yung Spanish flu. They would not immediately address na this is already a serious issue, people are getting sick. So noong una, trangkaso lang yan. Parang ganun ang nangyayari. And that's ultimately what ends up escalating the disease, no? The kind of disregarding it at first, which we saw play out about a year ago. People were saying, oh, it's not here, it's just in China. Or it's here, but it only affects Chinese people. Mga ganun. Or yeah, some people got infected, but they've been contained. Alam mo yun, parang constant, parang yielding, rather than assume the worst case scenario and then contain it there, no? And I remember even, so I was part of this group called the Corona Tracker, which was monitoring the coronavirus as early as January. Most of the team were from Malaysia. I'm one of the few in the Philippines. And we were thinking, do we want to do any predictions? Because that's also controversial. Like if you want to predict, and we were just toying with some probability models, no? Na okay, if like I remember, our first two cases were foreigners, no? And I think I don't know where they got sick, parang in the province Dumaguete yata or somewhere. And he said, okay, we have two cases, but if we assume a mortality and deaths eventually, but if we assume a constant mortality rate of let's say 2%, then there's likely at least 400 cases na or something like that, no? For two people to die, there's a gross value somewhere there. And they said that's too simplistic. It can't be right. And to be telling everyone there's probably 200 to 400 people walking around with the virus at a time when there were only 4 cases identified and 2 deaths was really sensational. Only to find out later, not 1 month after that, February then naging March, biglang, okay, from 4, naging 10, from 10, naging 50, from 50, naging 100, ayan na, exponential na. So, yeah, it might have actually been true na at the time 2 people died, there were already 400 people undetected at that time, no? But again, how do you make the call, to make that announcement without causing panic, without causing, alarm? I don't know, I mean, even if how do you deal with that, no?
Yeah, I remember what they said about the Spanish flu. We didn't have social media, so people cared about what was happening locally. So like if they hear in the other state, this is what happened, but they don't see it for themselves, then really there's that delay where they don't act on it yet. So really it's more of like there's a boon and a bane of knowing what's happening elsewhere and then also not knowing what's happening elsewhere. That you don't know how to prepare until it's really there at your doorstep. But if you know what's happening elsewhere, you start to panic or do other things that are not helpful as well.
And then I guess in addition to that, did you address the concept of politically charged news in your workshop? Because that's also something na apart from social media, it conflates this whole infodemic because it's politically charged.
Our end project was to actually do a pitch to the Minister of Health of Elnor Island. And so basically we had to tell him that his strategy wasn't working, right? And that's why you need an infodemic manager. So there's like all sorts of ways of like, how do we tell him? How do we make sure it comes across? Because then you have to convince this person to actually give you budget for the infodemic management. So how do you bring across the necessity and yet not hurt his feelings? For example, that the reason why you need this is because you didn't do this in the beginning, etc., etc. So yeah, there was really some discussion about the politics of it. But World Health being World Health, they always told us you have to support your Ministry of Health. No matter what wrong happens, you just need to support the Ministry of Health. So you just do the work that you need to do.
Yeah, and I think part of the additional challenge, like for example, I try my best to lie low already in terms of posting unless it's a confirmed source. No? Lalo na ngayon we're very conscious about it. because I don't want to be the one trumpeting ethics and being the first person to spread fake news. That would be supremely ironic. But you can't stop people who want to take pot shots at the government. It's such a nice, easy thing to do na. The government's incompetent or ayan na naman tayo. Like right now, it's vaccines, no? That's the big bugbear. And people are nitpicking. And so on the one hand, if you want to remain rational, you say, look, you have to assume that the government is trying its best. I mean, it cannot be trying its worst. Otherwise, the whole thing would collapse. But on the other hand, you can't naman excuse na despite that, there appear to be glaring lapses, kung ano man yun, that exist. And people being people. Ito pa, I don't know. Was this a thing? I don't know why people seem to treat Twitter like a chat group. No, not realizing that you're actually broadcasting it to the world now by tweeting, regardless of how many followers you have. Lalo na if you use a hashtag, pick up ka agad yan, no? That'll circulate. And people get shocked when they get quoted, or they get or people start accusing them of whatever motive. But when you read what they're saying, it's like they're on WhatsApp, or it's like they're on Viber. So I don't know if that's a cognitive problem na you don't realize that you've just picked up a megaphone with hundreds of millions of people when you tweet something on Twitter. You really have to be very careful about it, no? I don't know if that should be something that should be parang propagated, no, to people. To be very careful about what they say, no?
We tell that in the context of the medical profession. So at HealthX PH, that's one of the things we started. One of our very first products was to actually come up with a social media manifesto for medical professionalism. In one of my presentations, I liken it to being in an elevator, right? What you wouldn't say out loud in an elevator, you shouldn't probably post it online, except that the size of this elevator is there are millions in the elevator with you if you're on social media. And I guess that brings home to the point for some, but sometimes they just forget that that there's so the boundaries between what's supposed to be kept for yourself, it gets blurry.
Yeah, and then the other thing as well is, and for someone such as yourself, now you've been working to combat medical misinformation for so long, no? But so for example, you talked about diabetes, no? But diabetes is a very familiar, quote unquote, disease or familiar condition. So people don't get necessarily alarmed, even though you want them to be alarmed and be careful about all the sugar they eat from McDonald's, and etc. But then you have the pandemic, and then this is, I think, our first pandemic during, kasi we had SARS, but actually SARS predated Facebook technically, no, 2002, no, wala pang FB. So this is the first. We had Friendster back then, pero it wasn't as prevalent. So this is the first pandemic that's superimposed with social media, no? And
Yeah, it is.
so that's one. And then the other thing is, suddenly it's the era for experts to come out and give whatever, declarations or opinions they have. That's, I think, also a first. We've just had so many qualified doctors and scientists suddenly on social media posting all sorts of stuff, papers, preprints, mga ganyan, no? And I can't imagine how 99% of people can read a preprint and understand it, or I can read a research paper and make sense out of it. Now, this is the first time people have just been bombarded by all that technical information. And then you mentioned this earlier, na you're trying to debunk something, pero people had never heard of it. But since you mentioned it, now they've heard of it, and now it's spreading because of your attempt to debunk it, no? So parang nagkakaroon ng negative feedback, parang loop of some sort, no? I don't know do you have any thoughts about that and how we can
So
manage
when
that?
we started HealthX PH, it was really with the thought that we need more medical professionals online. And I've been talking about establishing personal learning networks online because I've used Twitter as a way to connect with endocrinologists elsewhere, etc. And then I have my Facebook page. But in my Facebook page, for example, I talk of myself as Doc Brew, right? But really, I'm an endocrinologist. I'm an honest to goodness endocrinologist. But it has happened that I have followers who are seeing other endocrinologists. They're not my patients. Because when I started the page, I didn't even invite my patients to like the page because I felt like my patients, I can, deal with their information needs. They come to the clinic, I can talk to them. So this page is really my advocacy for other people who are not able to see an endocrinologist because there's so few of us and they have questions that can't be addressed online because there's nothing written in Filipino. But it's really funny when some of these followers I have will go to their endocrinologist and say, Doc, I read about this Doc Brew. Do you know Doc Brew? Is Doc Brew really an endocrinologist? And what lang, because I give talks at the conventions, the other endocrinologists know that I am Doc Brew. And so they are able to tell that person, yeah, she's really an endocrinologist,
Legit yan, legit. Hindi yan
Yeah,
influencer
but
lang.
that kind of thing doesn't happen, I guess, for the other people online, right? I mean, how do you actually verify that they are who they say they are? And what's really funny is it came to a point where I even had to tell the information desk at the PGH, because the information desk would call the endocrine section and say, there's someone looking for Doc Brew. And we know that there's no one there by that name. Why are and I will have to say, no, that's me. So things like that, and that's when I realized that there are ways to do this, but then you can't control how it actually gets out there.
Yeah, and then I don't know how you've also dealt with this, pero I think for the general public as well. Well, clearly there are more than one kind of doctor, no?
Yeah.
Endocrinologists and various specializations. But when people seek advice and a doctor gives an opinion, parang it's enough na a doctor said it. No, parang even though the doctor's specialization might be something else, no, it also applies to I guess scientists. No, you have the classic one was there's a term for it, armchair epidemiology. No, everyone's an epidemiologist all of a sudden. Everyone's doing these models and these calculations and declarations. No, and we've had to contend with that in the data space as well because it's so easy to just get data, run a curve on it, and yun yung forecast. No, and lalo na if it's someone of some reputation who maybe they're good in one particular field of science, but not necessarily epidemic models. And then people say, oh, sabi na ni ganito ganyan, is there, no? And how do we resolve that? I mean, kasi you'll explain na, well, sir, so-and-so is not really an epidemiologist, but they know how to fit a curve, mga ganyan. It's hard to listen to if you're the public. Parang, yeah, but sino ba talaga yung expert? Tell us na lang para we can listen to that person, no? Parang ganon, no? I mean,
Yeah, that's really hard. Because, for example, if you have diabetes, you can be seen by a general practitioner, you can be seen by an internist, an endocrinologist, a diabetologist. And so sometimes I would get loaded questions on my page. If I have diabetes, who should I see? Okay, and so I have to be very diplomatic about how I answer. Or sometimes they would ask questions. And I try to answer in as general a manner as possible because I don't want to make it look like it's a consultation. And then you will be surprised that sometimes the reply will be, oh, so that's why, because I wanted to check that with you because my doctor said. So it was really like they're trying to make
very
sure.
Confrontational, no? Adversarial ang dating.
Yes, and you didn't even know that you were in the middle of that. So if you had said something different, how that could have exploded. You said that and she said that. And then when the patient now goes back to the clinic, but Dr. Bruce said, and that's when it might get into, some controversy already.
Yeah, and I guess that's just the added challenge we face today, on doing that. So, okay, you're doing your research, you've gone through this workshop. Can you talk a little bit about what are some good next steps, no? And I'm not talking about apart from WHO prescribes, no. I mean, if we're going to address, because we have quite a variety of people watching us right now. Data people, medical, public health. I mean, what's a good concrete initiative that we could probably boot up, or maybe talk about what you're trying to do in the Health XPH group as well. so we can all find a way to participate.
Okay, so but with respect to this infodemic manager training, there's going to be subsequent trainings from the World Health. However, the four of us from the Philippines who finished this, we had thought about actually cascading some parts of it, or actually just calling for a conference where people can come and we can discuss what people are doing. Um, so because even inside the university, for example, we didn't know that so and so was doing this and that, and it was related to what we were doing. And now that they've heard me talk about it, they said, "Hi, I didn't know that you were interested in that. We were running some, like this afternoon, I heard somebody was running semiotic analysis of vaccine tweets or something." So you find this common spaces, and maybe a conference or maybe something like this where people can discuss can be another start to really discuss infodemic management. As far as health exchange is concerned, every year for the last 5 years. So I think last year, pandemic year, we had the sixth one. Yeah, we have a health XPH social media summit in cooperation with the PCHRD. And we usually bring together people who do social media research. And then we have an academic track where we talk about how academics can use Twitter as a personal learning network. We had some workshops on like how do journal publishers or journal editors um, use visual abstracts, for example, on Twitter so that there will be more people reading the journal. And then we also had the ethics track talking about mostly medical professionalism. We have a track on patient advocacy because there are also a lot of support groups now on Facebook. So like there's a very big Philippine diabetes support group. There's psoriasis group on the Facebook and also Dialysis Philippines, etc. So we also give them a space in the social media summit. So I don't know when it's going to be for this year because we haven't planned it out yet. But usually every year we try to hold one, and there's still a lot of interest. And last year, when we held it very late, around July or August, I think, there's a lot of interest because people are looking for research. And they know that the data is online, and so people don't have to go out into the world because there's quarantine. But we also have to discuss the ethics of it. And I think now, since last year, the ethics boards are getting more adept at, seeing whether you need more consent or you need this kind of disclosure, etc., as far as conducting online researches, whether it's going to be exempt waiver of consent or not, etc. Because in the past, there very few people were doing it. So it was really hard also for research ethics boards to look at the protocols because they were not familiar. So for example, for this particular project, we were talking about, natural language processing, et cetera, et cetera. So the reviewers had to ask us a lot of questions because they couldn't understand how it was done. And so we had to really explain that to them. So those are the two things we're looking at for health XPH.
Yeah, in fact, I don't know if I mentioned this, we're also in the middle of a research as well. We actually put out a preprint already on just trying to create standardized measures of an infodemic, borrowing from like epidemiology. Like, can we calculate a reproductive number for it? Can we calculate, I mean, one of your slides says it's hard to compare fake news with viruses, but actually if you do, in a way, parang topic modeling, it does begin to resemble viral mutations. But I guess the question lang is it just analogous or is it really an underlying phenomena? No, yan yung question. And then the question I wanted to ask you though is, so infodemic is a thing. It's more a thing now than before. What's the downside of this? No, kasi syempre epidemic, you get sick, you could die. Can we really pin down, let's say, like a fatality rate for infodemics? Is it possible to? I mean, that's a problem we're trying to also solve, no? Pero why care about infodemics in the first place, apart from undermining, health efforts? Any thoughts on that?
So that has been a question ever since the internet started. Because for doctors, at least there was a time, and there are still some doctors who are like internet averse. So They don't like, having patients go on Dr. Google and finding all sorts of things. So they think the internet is an unsafe space. And so the challenge there is people are asking, did somebody actually die from reading something off the internet? And unfortunately, there have been some, and especially in the context of this pandemic, right? People taking all sorts of things that they read and it was the wrong thing. um, so so yeah, I think we really should care about the infodemic because it can, if not result in fatalities, it can delay treatment. It can make the pandemic last longer because people aren't doing what they're supposed to do because of wrong information that they got. Eventually, it all adds up. And right now, I think the concern for me is really the not having trust in the science. Because I think when you distrust science, everything starts to go downhill from there.
Yeah, we're in a way recreating the dark ages, no, where science is bedeviled. But I don't even know if that's it. Parang yeah, the trust factor is there. And then I don't know if you will agree, no, but especially on social media, we have what's the best way to explain it? Parang the general public has a tendency to be anti-intellectual. If you try to sound too smart online, you get ostracized, no? Parang ikaw na nga yung magaling, parang ganun ang dating. And which just destroys all attempt, no, to explain things, no, lalo na when it gets politically charged. And I can feel for people, for example, such as yourself, no, who are on occasion in a way appointed as a spokesperson for a particular medical issue or cause, no, you really will be at the firing line, no, for people who minsan may yung alam mo yung expression na mema sabi lang. they'll just throw a rock at you just so may masabi lang, and then they'll go private to avoid the retaliation. It's just the behavior of people online, no? I'm sure there's probably a pathology to it eventually, na psychologists will figure it out na ganyan pala yung it's a normal thing to expect. Pero right now we're just in parang the worst intersection of all these behaviors, eh. Plus you have the
Yeah.
pandemic ongoing.
So I've been trolled, so I know how that feels like. But also, it's really the thing about the worldview. So, for example, the rheumatologist in the PGH came out with a book about gout. So it has something to do with uric acid. And they were saying that bungo is safe to eat even if you have gout. And that goes against the worldview. Everyone's worldview is if you have gout, you have high uric acid, you cannot eat mungo. Okay? So, because I was trying to help them advertise the book, so I posted it on Doc Group. I was so unprepared for the onslaught.
For the
All
backlash.
these
Oh my
angry
gosh.
people telling me that is wrong. How can you say that? We are an entire family with gout, and every time I eat mungo, I actually get a gout. And no amount of science explanation, no amount of even saying I'm not a rheumatologist, but the rheumatologist in PGH said this and that. No amount really of explanation ever overcame that. And I said to myself, I'm never going to post again about mungo ever.
Yeah, and then there's also an expression the internet remembers. Alam mo yun? So for example, you say something now, no? Somehow, somewhere, someone will dig up a tweet that you did 4 years ago and said, this same person said that, ganyan, ganyan. And, or they've just been waiting in the bushes for you to say something, and then they'll take a sniper shot. And it happens a lot, lalo na people who have a following. Like, I don't know, I'm not naman I'm not at like mega influencer level, no, but I've had my moments where I've also been attacked. Yeah, it's not pleasant. And the best thing you can do is just either take it in stride or shut down the internet. You just don't wanna be online muna. Otherwise, it's already a threat to your sanity to be nitpicking and answering each and every comment. No, that's a problem. Okay. Sige, I'm just being conscious of time, no? And it's been a really great listening to all your discussion in Infodemics. It's obviously an open topic pa rin. I was wondering if you had, I don't know, several takeaways you want to leave with the audience, apart from the initiatives that you're involved in. Anything you want to share or leave behind as advice?
So I've been talking to people for a long time about really trying to be conscious about what we share uh, online, and that we always need to sort of like triangulate and see whether this thing is really what it says it is. Some way of actually measuring whether it's true, correct, factual, or accurate. And it's easy to just say that if someone shared it, let's just share it as well. And people say that they share what I post, and that makes me very nervous because if I post something that is in any way not correct, I would appreciate being told that that is so. And I've had that happen to me, uh, where somebody told me, "Oops, what you shared actually like this and like that." So let's do that for each other. I think that's what I want to say. Do it yourself, and then let's do it for each other also, so that we can uh, keep the internet somewhat safe for most of us.
Yeah, I think that's universal advice. Apart from being human online, no, it's funny, no? Parang we talk about let's just be nice to each other. Pero I don't know, something about the social network environment, no, it really brings out the worst possible combination of behaviors. And then later you regret it, no, if you're not ready for it. I'm so sure some of the experts we may have been alluding to earlier who may have said something would probably regret what they have said, no? And in the heat of the moment, wala eh. You really want to answer every, or maybe you're used to an environment where direct feedback, kunyari in a classroom, no, face to face, direct feedback is best. Pero in a social network, it becomes viral, no? So you throw out an explanation, someone will throw out a counter explanation, which forces you to re-explain what you explained, and then before you know it, you've already created a
Or
trending
even the
topic.
subtweet that you don't see, but a friend will show you. Look, they're
Yeah,
talking about you. You didn't see it, but
yeah. They'll take a screenshot para hindi ma-search, no? Take a screenshot of what you did, post it. Oh yeah, that's horrible, no? But just take it as it comes. Okay. So I think that's a high note. I think we can end it on that note. There's definitely more we can talk about. Maybe in a follow-up podcast, maybe closer to the date of that. I don't know, Infodemic conference, no? That.
yeah.
But in the meantime, do you want to plug where people can find you online? And I know Health XPH is every Saturday at 9 o'clock, right? So that's
Yes.
that's one venue that well, I don't always answer, but I always read because it's really really cool seeing all these medical and health professionals share stuff with each other. So apart from Health XPH, how else can people follow your work?
Well, I do have my blog, so it's endocrine-witch.net. And then I have my Facebook page, which is Endocrine Witch also. Those are the main things. And then Twitter.
Yeah. And is it also a mix of infodemic and and diabetes, or halo-halo na rin siya?
The one on Facebook is really for patients. So it's
Ah,
really more about health information. The one on my blog is where I put the blog post that I create when I moderate Health XPH.
right.
And then some of the other things that I might get involved with that I find time to write for, I put it there.
Yeah.
I do have a SlideShare account where I post all my slide decks. I think I have almost 180 slide decks there, but it's a variety of topics. Some of them will be about misinformation, some of them about endocrinology and health informatics.
Yeah. Okay. Yeah. We'll also make those links available in the comments so people can find it. Okay. So yeah, with that, thank you very much, Doc Iris. Hope to see you again in another data ethics conversation. And yeah, the infodemic space is still evolving, so it's something we hope to continue to talk about.
Okay, thank you.
Thank you very much.